Hi, it's Dr. David Danielson here at Caring Paws Animal Hospital, and I wanted to show you guys today how to give SubQ fluids. This patient is Zoe. Zoe's recently been diagnosed with kidney disease. Part of the treatment for renal disease is sometimes augmenting their oral consumption of water with giving fluids under the skin. To achieve this SubQ fluid administration, what we typically do is use a IV bag, and in this case we're doing IV saline, and we then will take and have this flow under the skin. So I wanted to demonstrate first how we do this, as well as go over some tips for those that are doing this and how to make it easier. So first off, related to this, a lot of times people will complain that sometimes when they get the bag or they mess with the bag, this chamber, which allows us to see the flow, is overfilled. Of course, what you do if that happens, as in this case, is you invert, squeeze some of that back into the bag, about halfway, so then you can actually watch the flow. So in this case, I want it to go as a steady stream. If it was a drip, you would watch it dripping and could do calculations if it was given out IV. So after that, there are ways that we occlude this and keep it from flowing. Of course, there's a little clamp, and then there's this spinning wheel. To get it to flow, you want to open this up, and sometimes if you do that prematurely, you'll get wet or you'll spray it across the room. So I usually leave that clamped. And then lastly, we have the, and of course, when you're going to do this, it would be good to let it flow first to remove any air from the line. Since we are giving this subcutaneously, it doesn't hurt if a little bit of air goes in there, as it would if you were doing it IV, but still I like to make sure that it's all clear. And in this case, we've already achieved that. Lastly is the needle. So this is a topic of discussion. There are several sizes of needles that are sometimes used, and it all depends on the rate of flow, how much of a concern is the issue. So in this regard, I like using an 18 gauge because that tends to be a large needle and it goes more quickly. Some clients, if they use the 18, find that it's a little more uncomfortable for them to be poked with that, so use a smaller gauge, which is fine. It just takes longer for it to flow. So it's a balance between which is a greater concern, the time that you're staying there or the first injection. So 18 is a nice happy medium. So in this regard, we'll go ahead and, I know my love, a lot of clients, and myself too, what we'll do is if you have an area of the house where you do this, I would take a cabinet, maybe in the washroom or something, and put a little hook behind the door, and then you could hang this when you're flowing, so you don't have to, or if you have someone to help, they can hold it for you too. If you do it by yourself, it's a little more cumbersome. You ever hold it in your teeth or you're squeezing it, so it's nice sometimes to have a place to hang it. And in this situation, I have an extra pair of hands. Thank you for being my IV pole there. We'll go ahead and, also giving the fluid subcutaneously, we're doing this in the space beneath the skin. So in this case, you would tend to, you're creating a pocket by which you're going to fill that pocket. And there's different ways this is done. First off, they call this tenting. And a lot of people like to do it as a tent. In this case, I've tented. You're creating this tent, and they like to go in the front of the tent, as we would if we were entering it. I don't like that, actually. In this case, you would go into that space if you went through the front of the tent, and then you would drop that and then let it flow. I actually like to do it on the side of the tent. So I create my tent, and I like the fact that I have a smooth, basically flap there that I then can pierce through into that space beneath. So I'm going to demonstrate that and actually give some fluids right now. You can and should perhaps do it bevel up. You can see how that's open there. And then I tent, and then going to the base of the tent, you pierce. And that's it, just a quick flow. And then if you have someone to help hold, I'm going to open that up. And then what you'll do is you will then adjust, and you'll see it flow. So now this fluid is going into this, I call it a third space, a space under the skin, creating a bleb. Now I'm quite impatient, so I like to put pressure on the bag so that it flows more rapidly, because the child doesn't want to sit there for too long. And as you can see, they begin to get a little uncomfortable because it's cold, and we'll talk about that as well. But as you say, you let that flow in, and then when you're done, you turn it off. And how much should we give? Now, we had given some a little earlier, so I'm not going to give the full amount, but you would want to do about 100 cc's typically. You remove it. There may be a little bit of leakage. Don't worry about that. It's just a few drops at best. You could put a little pressure there and it's fine. What I tend to do too is I like to move left and right, sometimes giving a little bit to the left or to the right. And again, I like to do 100 cc's. Now, some tips and tricks. One of the reasons that they complain when you're giving the fluids, and one of the reasons that we were complaining here about the actual giving, is that this is cold. I mean, it's about 72 degrees in here, and this child is about 102.4. So it's almost like getting ice water down your back when you're giving it. That's why often they're very tolerant of the piercing. When you start to see it flow, initially they're like, okay, it's all right. And then as that cold water accumulates, they're like, I'm tired of this. A way that you can solve that is, well, now it's a little cold out, but during the summer months, I leave my bag in the garage. So in there, it gets to be about 90-something degrees, and it seems to make a huge difference in regards to their discomfort. Again, depending on the size of needle you use and how comfortable you are with the poke, once you give that warmer fluid, they kind of sit there and take it. They don't mind. Another thing I've always discovered, and this is really important, I do believe they associate this with feeling better, because I find that initially I'll do it, they might be a little fussy about it, but after we do this on a daily basis, they don't mind as much. In fact, to the point where some of my kids at home will let me do it by myself. We'll just sit there while I'm doing it. And no one would do that if it wasn't beneficial or if they didn't notice. So I do think as these toxins are out of their system, I think they feel better after it's done. And with that association, they almost look forward to it. So I do have a lot of clients that take advantage of this as a means of keeping these children on the planet longer, and it really can help in their quality. I know it's a little scary, but if you're brave enough and have a right relationship, you can get it done.